this is Dr. Eisenbrown. I'm here to answer some of your questions about the common urology problems that we see. So the treatment options for overactive bladder and urge urinary incontinence are sort of based around the pathology. The AUA, which is the American Urologic Association, has guidelines on how we're supposed to address overactive bladder and urge urinary incontinence. The first thing that they recommend is pelvic floor strengthening along with some lifestyle modifications. The lifestyle modifications they talk about are things like managing constipation, avoiding caffeine and other stimulants, doing timed voiding and things like that. As far as the pelvic floor strengthening, the reason that's so important is because that's the underlying pathology. And if you strengthen your pelvic floor muscles, you will regain control over your bladder. Another way that pelvic floor strengthening helps is that every time you contract your pelvic floor muscles or the urinary sphincter, you actually send a signal to the spinal cord that sends another signal to the bladder telling it to relax. We all know that's true from examples of driving down the highway and you have to go to the bathroom and there's not a bathroom nearby. So you kind of squeeze so that that sensation to go to the bathroom goes away. Now we all know it's going to come back and you still have to go to the bathroom. But if you do that systematically and repetitively, you actually train your bladder to calm down. So that's why the AUA recommends pelvic floor strengthening as its first-line therapy. The second-line therapies are all the medications. You probably all have seen commercials on TV where the woman is following her bladder around or some of the other medications. We're very blessed now to have probably at least 12 or 13 FDA-approved medications for overactive bladder and urge urinary incontinence. So generally we can find something that works very well and has minimal side effects for you. Generally the biggest challenge is trying to find one that your insurance company will pay for, but we always find something that they'll pay for. There are third-line therapies. They are procedure-oriented. We generally don't get to those unless you have failed the first and second-line therapies, but I always like people to be aware of them from the beginning so that you understand that there is a path and a process to get you better. The three third-line therapies are InterStim, which is kind of like a pacemaker for the bladder, Botox, which we can actually inject into the wall of the bladder, which will partially paralyze it, and then there's an office-based procedure called percutaneous tibial nerve stimulation. That's where you come to the office once a week and we stimulate the tibial nerve for 30 minutes. After about 12 weeks, we see how well that's going to work for you. We will discuss all of those in further detail if you ever get to third-line therapies, but certainly we would try pelvic floor strengthening and medications first.